morning, everyone. Just awaiting Stephen, who is the technical man. He just said he's going to get a boom to put the mic on so that we can speak from the podium. So he just said he's going across the street, so he should be back here in another minute. I want to start in another minute and a half. We can hear you though, anyway. You can hear me? Yeah, perfect. Yeah. You know, sometimes you'll ask the person, can you hear me in the back? And the person said no. So how do you get to say that? So shall we begin until he comes back, yeah? I think my voice is loud enough. I don't have to use the singing voice. So let me start by saying a hearty welcome to each and every one of you. His Excellency Milton Innes, High Commissioner for Barbados in London, Deputy High Commissioner Reverend Charles Morris, distinguished members of our elite panel this evening, ladies and gentlemen, I welcome all those online audiences, whether they're streamline, YouTube, or Facebook. I bid you a welcome to the Barbados Cultural Organization in conjunction with the Barbados High Commission for presenting Series 2023 Diaspora Outreach Health Talks. The topic today is Prostate Cancer Awareness. So I want you to sit back, relax, and enjoy what we have to present to you this afternoon. I will now call on my good friend, Reverend Charles Morris, Deputy High Commissioner, to lead us off with a word of prayer.
Good afternoon, everyone. Let's pray. O God, our Creator and Sustainer, in whose image we are made, we thank you for this day in which you have granted us. We ask your blessings on us here this afternoon as we seek to discuss matters pertaining to our health. We pray that your Holy Spirit will with us to guide us through this meeting. Give us clear vision, good understanding, that when we shall leave here, we'll be able to say it was good to be here. We ask you to bless all those who shall speak, all of us who shall speak, and we pray that you will be with us now and always. Amen.
Thank you, Reverend Morris. As I said earlier in my welcome, we, the members of the Barbados Cultural Organization, embarked upon other events other than the two events that we have been having over the number of years, the charity ball and the cricket. And we decided to do an outreach program to get the diaspora more involved in what we're actually doing. We are going to be having 3 of these events, today being the Prostate Cancer Awareness. Then we're going to have in May the talk on hypertension as well as diabetes. And then in October we will have the Pink October month, which is cervical cancer, breast cancer, ovarian cancer, those cancers that affect the female. This evening we have put together a powerful panel. You can see all these smiling faces sitting here in front of you. Thank you for welcoming them. You may applaud. Yes, please. Thank you. First, before we progress on the panel, I must make an apology from the leaflet you will have seen. Roshna Bahula from North Middlesex Hospital, due to unforeseen circumstances, she is unable to be with us this evening, but she sends her blessing. But we have a good friend of ours, Mr. Vasco Stevenson, who is a health awareness activist for prostate cancer, Barbadian by birth, cricketer, sometimes by profession. He is going to do his presentation as well. We have Mr. Patrick Williams, Prostate Cancer UK. I had a long chat with Patrick, and he does have a story to tell, and I know that we're going to be enlightened by his deliberation. And we have Dr. Jonathan Noel, consultant urologist. And as a person who would have gone through the whole journey of prostate cancer myself, I know how important it is to have a urologist to deliver something like this, presentation like this for us today. As I said, I had my bout of it, 2018. I had stage 3 prostate cancer. I had the radiotherapy and then hormonal treatment. And I am in remission, and thanks to the Almighty, things have been progressing very smoothly with me and for me. So without any further ado, I am going to call on my good friend, Mr. Vasco Stevenson. If you can give him a rousing round of applause. Who will come to the podium and give his presentation at this point in time. Vasco.
Thank you, Colvin, and good afternoon, everyone. After such an introduction, I think I shall pack up cricket. I feel very privileged this afternoon to be making this presentation and sitting on a panel with such distinguished guests, but somehow I feel like a warm-up comedian, you know, the guy who goes on first and warms the audience up for the big names that are coming afterwards. That's how I feel. My first encounter with prostate issues started way back in 1982 when two of my very dear friends died from prostate cancer. Although they say prostate cancer is the type of cancer you will die with rather than from, they died from it. And I took myself off to a clinic in Oxford Street, and I had my prostate checked. I didn't know much about it at the time, Mark. They died from prostate cancer. I'd better get mine checked. And the one thing that alarmed me was not the PSA blood test, but the digital rectal examination, which seems to be a very sore point with most men. And I've spoken to several men, over the years that I've been making presentations and raising awareness about prostate issues. And the one thing that they cannot have is the digital rectal examination. Okay? Right. And one of the reasons for that is that they're a bit homophobic. I'm not going to have anyone inserting anything in my back passage, despite the fact that they have a choice. If they don't want to have a male do it, they can ask for a female. Okay? And I'm going to get my little joke out of the way first. A joke about an old man named George who went to have his prostate gland tested. And a very beautiful, curvaceous young lady was carrying out the examination. And she said to George, I would like you to lie on your stomach, and I'm going to put a glove on and a bit of moisture, and I'm going to insert it into your back passage, because that is perhaps the only way you can get to the prostate gland without an operation. And she said, when you feel my finger, say 99. So said, so done. George, turn her up to on your left, I'm going to do the same thing. Once again, say 99. And on the right side, say 99. Now, George, I would like you to lie on your back for me. And I'm going to do the same thing. But because of your anatomy, I've got to use my left hand. I think you know where I'm going with this one. I'm going to use my left hand to move that part of your body out of the way. Okay? And once again, I want you to say 99. And George, being a scheming old guy, he started 1, 2, 3. Okay. I've been making presentations of raising awareness of prostate cancer ever since 1982. And I, at one time, belonged to an organization based in East London called the Association for Prostate Awareness, which I believe was set up by Professor Frank Chidawunda. And I spent many years there, and there are a couple of good gentlemen from that organization here. One thing I cannot understand, though, is the reluctance of men to have an examination. Every year I used to go and have an MOT, and I would say, okay, fine, I'll check when you take my blood, check my prostate and let me know how it's getting on. But somehow there's this reluctance, especially among Afro-Caribbean men, to go and have perhaps any medical procedure, but none like the prostate, okay? And yet it is one of the things that affects black men more than any other racial group. We have a greater chance of suffering with prostate cancer. And according to the Johns Hopkins Hospital, Afro-Caribbean men are more likely to suffer with prostate cancer than any other group, and that cancer in the Afro-Caribbean men has a tendency to become aggressive. And when it becomes aggressive, then anything can happen. It can metastasize into the bones and create more problems, severe problems, because when it starts to spread, then it becomes a major issue. And in my time of presenting on the prostate, I had the pleasure of presenting at Croydon University Hospital, Queen's Hospital in Romford, and I did 4 presentations at Whittington Hospital in Archway. Now, when I speak to men and they tell me about their prostate, it's enlarged, or they have cancer, I say, well, tell me a little bit about your lifestyle. Tell me a little bit about your diet. And invariably I get a cross-section of comments about, oh, I eat this and I eat that, and what have you. Now, I believe in the principle that prevention is better than cure. And if you start to eat what is considered an anti-inflammatory diet, then you're going to reduce your chances of getting prostate cancer. You're not going to necessarily reduce your chances of an enlarged prostate, okay? BPH, benign prostatic hyperplasia, because that is the result of a hormonal change that takes place. You know, when we reach a certain age, it used to be 50, but now we're looking at 40 and late 30s, because all the degenerative diseases are beginning to show up in younger and younger people. Hence, it is very important to get your diet and lifestyle right. Eat to prevent it. And we go through, we go through a change called the andropause. And most doctors refer to it as low testosterone rather than, a male change. Not quite similar to the female change, but not as pronounced and clear-cut. But it is very subtle, because my research tells me that when a man reaches the age of 30, his testosterone, which is the male organ, the male hormone, drops off at about 10% for every 10 years. So by the time a man reaches the age of 60 or so, his testosterone has dropped off considerably. But when a man reaches 40 and these hormonal changes start to take place, testosterone dropping, obviously the counter hormone, estrogen, which is the female hormone, starts to rise. And that is, you know, a man starts to get a bit of a beer belly. You notice my chest is flat, yes. A bit of a beer belly and a little bit of a low libido. In our term, we say he's flying at not full mast, but a little bit below full. Okay. And those are signs. And of course, there are other signs. Instead of being able to stand here in this room and pee over to the other side of the street, he's now going into the bathroom and looking down at his shoes to see if they're wet. Things like that, yes. Low libido, weak stream. But what I emphasize more than any other is urgency. Urgency. Imagine this. This man is dressed up to the hilts. He's taking his missus out. It's a big occasion, and she's dressed up. He's dressed up. And they're driving along this way, going to the venue, and his problem is urgency. But along this motorway or A road, there isn't a pub in sight. There's nowhere where he can stop and relieve himself. Now, can you imagine what's likely to happen? And if it happens, okay, what effect is that going to have on the evening? What effect is it going to have on the relationship? All of these things you have to factor in. And what about the children? Because children are very sensitive. If you have children, they can see the tension mounting between mom and dad. And that can affect them in their schoolwork or, you know, their lives. And this is one of the reasons why we always say to men, come or go and get your prostate gland checked. Anyhow, when men phone me up, and they still do, quite a lot of them, and ask me about the prostate, and you know, this is happening and what have you, I try to look at certain dietary means of helping them relieve the pressure on their prostate gland. And I will ask them, well, tell me about your diet first. And they will tell me, oh, I had some fried chicken, I had chips, I had this, that, and the other, and rice, and what have you. I said, okay, have you eaten any of the green vegetables? Have you eaten broccoli? Have you eaten any spinach? Do you eat onions? Because onion, simple thing, contains a compound called quercetin, which is very effective on the prostate. I said, do you use turmeric? To my mind, the best herb in the world. Remember though, always use it with black pepper. Okay? If you're using turmeric and you're using it on its own, you're just wasting your time. To get it to work, the compound in turmeric, which is curcumin, has to work synergetically with the compound in black pepper called piperine. Okay? So they work together. And they do wonderful things in your body and, of course, with regard to the prostate as well. Do you eat tomatoes? I don't like them, but I do eat them. How do you eat your tomatoes? Do you fry them? Do you eat them raw? Because the best way to get the lycopene into your body from the tomatoes is to have them slightly cooked, again with a bit of black pepper. And I go through all of this when I'm making a prostate presentation to let men know that there are ways and means that they can benefit the prostate by changing certain aspects of their lifestyle. Okay? I also asked them about zinc. And a lot of people don't realize that most of the zinc in your body is in your prostate gland. It keeps the prostate healthy. It keeps your sperm healthy. Yes? And men with very little zinc have weak sperms. Yes, they can't swim to fertilize the egg sometimes. And I say to them, okay, 25 milligrams of zinc minimum per day. And they'll say, okay, fine. They'll go away and do it, some of them. Others wouldn't. Others would rather see a urologist, like Dr. Noah, rather than listen to me. Oh, no, I'll go. I said, okay, that's your choice. But I'm telling you how to make certain lifestyle changes and dietary changes that will reduce your risk of getting prostate cancer. Now, one of the best hospitals in the world, in America, Johns Hopkins Hospital, 27 years, America's #1 hospital. They put out in 2013 a statement, and I say this to every man I speak to. Black men who have been diagnosed, no, they didn't say black, they said Afro-Caribbean men who have been diagnosed, yes, with prostate cancer or any other kind of ailment should add one more number to the number we've given them. So if they say your PSA is 7, then you should add one more number to that and accept that your PSA is 8. And the reason they gave for this is that the equipment they use is not calibrated for Afro-Caribbean people or black people. Yes? That's why when they're testing their equipment, they only use white rats, white rabbits, white mice, but not melanated rabbits or mice or anything like that. And they were brave enough to come out and actually say it. Okay? And testosterone and estrogen. There are simple ways that a man can increase his testosterone if he's flagging and reduces estrogen. And in 2012, there was a European study which said the problem with prostate cancer is simply the hormonal problem. I know here in the UK they talk about bioavailable testosterone and other things like that. But this came from Europe. And one of my favorite doctors, Dr. Jonathan Wright, he actually said, if testosterone or low testosterone is the problem with prostate cancer, how is it that we've got some young men out there running up and down who are literally testosterone on 2 legs? How come they're not suffering from prostate cancer? And he thinks that people should have another look, or the establishment should have another look at the relationship between testosterone and estrogen. So, I don't know how long I've been given to speak, but yeah, can I carry on for a few more minutes?
2 minutes.
2 minutes, okay, right. Testosterone, the male hormone which gives you your libido. How do you increase it? Well, there are different ways of increasing it. You can do intermittent fasting, which has a very powerful effect on the whole body. You can take zinc. You can exercise. Okay? You can keep away from a product called soy or soya. To my mind, the worst thing that's ever been put on a plate, because it's a major hormone disruptor. And if you want to turn boys into girls, you let them eat a lot of soya because it promotes estrogen. And of course, zinc is one of the best things for increased testosterone. By the same token, you want to reduce your estrogen. And that can be done quite simply. In the skin of the lemon, there's a compound called dilimonene, which is very effective in reducing estrogen. So all a man has to do is scrape the skin off the lemon, pour some hot water on it, and drink it. And that will reduce his estrogen. The intermittent fasting or the zinc or whatever will increase his testosterone. And what you do there is bring back a balance. I'm not saying it's a 100% cure, but it's going to bring back, to some degree, the balance between the two main hormones at play where the prostate is concerned. Okay? So all I'm going to say, I'm going to hand over to the professionals now and let them get their tuppenny worth in. So thank you for listening, and I hope you have taken on board a little bit of what I've said. Thank you so much.
Thank you very much, Vasco. Just a note that after the speakers have delivered their presentation, there will be an opportunity for some questions and answers. So what they don't cover here, you guys want to bring it out of them during the question and answer session, feel free to do so as well. And that also goes for those persons viewing online. If you can just type something in the chat, we will try to answer some of your questions and queries as we progress during the evening. Thank you so much, I said, to Vasco. And we're going to now call on a young man who I had the privilege of having a long conversation with, I think either this week or last week. And he has an even greater story to tell on prostate cancer. I now invite Mr. Patrick Williams to come and make his presentation. Give him a rousing round of applause.
Colvin, thank you very much for, first of all, saying that I'm young. I'm 66, I'm 67 this year, so I'm at that age where I can't turn the numbers around. So that's a very difficult process at the moment for me. And especially when I get to 67, I definitely do not want to turn those numbers around. Right, okay. My name is Patrick Williams, and I'm a volunteer with Prostate Cancer UK, but I'm also one of their speakers. Now, I've been speaking since 2017 for prostate cancer and going out talking about testing, PSAs, etc., but I never went for one. And I found it quite rich of myself that I didn't do this. So I thought it was imperative for me to go and get tested, especially when I was talking to black men about the need for going to tests. And you know when you get this little voice that's actually telling you, but you haven't done that. And I thought, okay, I'm going to go and get tested. So I went in October 2019 to be tested. I was 63 at that time. Now the current, now I heard a little noise there. Yes, I was 63. I know I don't look it. Clever lighting, you know, in here. So I went to get tested at 63 in October and thought nothing of it. I did it through the Wellman's Clinic in my hospital. I didn't hear anything back, so I assumed that everything was fine. I had a follow-up appointment in December, so then I said to them, what was my PSA like? Was it okay? And the very doctor that sent me for this said to me, did you have a PSA test? And I thought, is she mad? So she went and she looked on the computer with the results, and she took a step back, and I said, what's wrong? She said, oh, this is very high. And I said, how high? And she said, very high. And I said, well, how high? Very high. I said, this is not a pantomime. Tell me how high. And she told me, 149. I should have been, at my age, the maximum 4.5. So you see how far down or far away I was. They made me do the test again that very day. A week later, I was called back in, and it was 174. So it was climbing and climbing fast. So I did the prostate MRI and the bone scan, not understanding why I had to do all that, because they don't talk to you. No offense, Jonathan, but that's what happened in the hospital that I was at. No one told me what it was. So imagine my surprise when I went to see my urologist in January, on January the 8th. And she said to me, "Why are you here? We've met before, haven't we?" And I thought, oh my God, I had to have this witch. Right? I met her 3 years earlier, and I say witch because it was very important. I went in there with severe pain in my right lower side, and she sent me away telling me, without even examining me, "This is nothing to do with cancer, you're fine." And I was sent home. I find out later that it had something to do, and it was a symbol, a symptom that was raising its head. And here I was faced with the same woman. You know what she said to me when I told her? I said, "Well, we've done these tests," and she had a go at me. "How could you possibly have these tests, without first coming to me?" And I'm sitting down there listening to her thinking, hang on, I am a patient. Why are you having a go at me for having tests? So I thought, just a little background about me. I was a university lecturer. In fact, actually, I was a dean of studies, right? And my official title is actually Dr. Williams. I never used that, simply because I think it's quite pretentious, right? So I'm sitting down there and I'm thinking, I'm going to respond to her when she's finished in my best English. And when she was finished, I said, "Well, isn't it fantastic that someone decided to move very quickly to give me those tests, because now you have those results on your computer and you are able to make an informed choice as to what the situation with me is." She hadn't even looked then on the computer, but she did, and she said, "Oh my God, I take it all back." And I thought, why are you taking this back? What's actually wrong here? And she went out the room, and she said, "I need to do a DRE, so I'm bringing in a chaperone." So a woman came in, and Vasco, I can tell you one thing, and this is what it is. I would do the DRE any day. That's the finger up the bum, if you didn't know. I would do that any day than to know what was coming later. And I'll tell you about that.
Is your name George?
It was less than 5 seconds. Less than 5 seconds it took. And I looked at her face and I said, "Is something wrong?" And she said, "Yes." I said, "What it is?" She said, "I was expecting to feel something soft and squidgy, but it was hard and lumpy." And I said, "Well, what does that mean?" She went out the room, and when she came back in with a lady who was wearing a badge that was green. Okay? This is a prostate cancer one, but that green one was Macmillan. And I didn't need to ask any questions then. I knew what they were going to tell me. And I said, "You're going to tell me that I have cancer?" And she said, "Yes, I'm sorry, but we believe that this is. Every test that you have done is proving that this is. So we're going to make an appointment with you to go and see an oncologist. But we're going to give you a tablet beforehand, a tablet called bitalactamide." And I said to her, and I remember distinctly saying, "Is this going to solve my problem?" And she said, "Yes." I said, "This is going to get rid of what's happening in my body?" And she said, "Yes." What a load of nonsense. And I thought, this isn't going to do that. So, of course, I went home and I did my own research. And I thought, the next time I see this woman, I'm going to swing for her. Right? Because I thought, she is unbelievable. First time you tell me go home, there's nothing wrong with me. Second time you then argue with me. And the third time you're telling me that you've given me this wonder cure, which wasn't the truth at all. I then was called in 2 weeks after having this tablet to be told I had to get this injection, the first of many that I was going to get. And the person who gave it to me was a Macmillan nurse. And I said to her, I said, "Well, is it cancer?" And she said to me, "Let me be clear. No one can have the PSA reading that you have, and it isn't." And I thought, wow, okay. bring it on. Let's deal with it. When I met my oncologist, a very lovely woman, she was absolutely the most comforting person that I had ever met. And she encouraged me to say that you need to go and have a biopsy. Here's where the difference is, Vasco, where I said that I would do the DRE any day rather than do that. I went and I was in the hospital. And of course, you know, they tell you take all your clothes off, including your underwear, and put on that gown. This is the gown that does not tie up in the back. So everything back is exposed. So I thought, I'm going to be 10 times clever, and I'm going to put one in the front and one on from the back. I had not worked out the draft coming up from underneath. And I'm standing there waiting to go in, and I could feel the cold coming up through, and I'm thinking, God, how more or what more would I have to endure? When the door opened that was in front of me, I thought, you have got to be kidding me. There is no way I am going in there. So I got up to run. Now, I could afford to say this to you because you're not Jamaican, you're all Bajans here, right? I had there was a Jamaican nurse on my left. Right? A big Jamaican nurse. That woman was watching every movement that I was making, and she clocked everything. So as I got up to walk, this woman was, you see where that painting is in the back? That's how far she was to me. And she shouted, "Where you think you're going? Man, park your backside here." And I thought, oh my God. So I sat down and I thought, this is not somebody to tangle with. Right? So I went and I sat down, and when I went into the room, the horror that faced me. I take my hats off to you, ladies. Right? I take my hats off to you. There was this couch with the two bits that kind of move out at the end with stirrups on them. And I thought, tell me they are not going around my legs. And when I went on, they realized that they're strapping me into this. And then they strapped me across the bed. And of course, I am wearing nothing underneath. So when they opened that, everyone coming through that door would see the promised land. And I thought, there is no way I want to be in this situation. And I knew when they took every sample, because I could feel, I wouldn't say that I felt it, but I felt it, because it shook the table. I could not wait to get out of there. But let me tell you something else as well. Because they've got to inject the area, you have no control of your body functions. Let me repeat that, if you didn't get it. You have no control of your body functions. I was horrified. I grew up in a very prim and proper household, so having anything happening and I could not control was something I did not want. But I did it, it passed, it was fine. I waited about maybe 3 weeks later, I was copied in to the results of that biopsy by accident from the hospital to my GP. I remember seeing it when it came by email and thinking, oh, right, okay, let's see what it has to say. And I remember what it said. My Gleason score was 10 out of 10, which gave me an overall rating of stage 4. I looked at this for a while and think, stage 4, but I know that what stage 4 means, but surely this can't be as bad as what this is telling me. Then I saw another word that was there, and it was aggressive. Then when I looked and I turned the page, there was another word, a word that I just could not fathom. It said terminal. They had given me 18 months to 2 years to live. And I looked at this, and I remember bursting into tears when I saw this, and I cried for over an hour thinking, what am I going to tell my children? I have 4 sons. 3 of them gave me grandsons. The last one hasn't given me anything yet. And I've told him there are no more grandsons. It's a granddaughter there. Right? So I have 4 sons. My first one gave me 4 grandsons. Second one gave me 3. The last one gave me 4. Do the maths. You work out exactly how many grandsons that I have. And I know that I have given my sons a killer. Because if you didn't realize it, because I have had prostate cancer, my children have a 1 in 2 chance of getting it. And I thought, I do not believe this. What am I going to tell them? And I stayed there for a long time contemplating what I was going to do. Because I did not know how to deal with what was happening to me. And I rang Prostate Cancer UK, their specialist helpline, and I spoke to one of the nurses. And they were fantastic. They didn't solve the problem because the problem was still there. But they were fantastic. What the nurse kept saying to me all the time, I'm really, really sorry for what you've had to go through. I'm really sorry. But don't give up. Be strong. And I'm going to say here, and I'm glad to see women in the place today, because my big sister, my wife died many years ago giving birth to my last boy. So I had no women around me except my big sister who lives in Florida. And I contacted her to give her this news. And these were her words to me. Let me be clear, you are my number 1 priority now. And she rang me every day, propping me up and giving me the support I needed. As the saying goes, she provided me with succor. That kind of help was what I needed. I needed her strength because that was important. Now, interestingly enough, my sister's married to a Bajan, right? And I remember that I could hear him on the end of the phone saying, how come he got prostate cancer before me? And I'm thinking, hey, this is not sweets. You don't hand this around. So I spoke to him and I said, you better go and get checked. You're not of my blood, but you still need to go and get checked. He did, and it was great. He wasn't one that was affected. But my oncologist spoke to me very clearly, and she encouraged me to go for the treatment option that was being made available. And it was something that had come out of the Stampede 1 trial. Prostate Cancer funded that. I didn't know that at the time. And I remember having the chemotherapy and thinking, oh my God, what's going to happen? I did not feel sick. I had no diarrhea, no vomiting, nothing of that sort. The only thing that happened to me was the loss of my hair. If you could see from up here, you realize that my hair was black. It was not this color. So when it grew back, and it grew back this color, I thought, this has got to change. There is no way I'm walking around with this. So I got the Just for Men. It said 20 to 40 minutes. I did it for an hour because I was determined that this was going to go. Imagine my horror when I went under the shower and I washed it out to go and look into the mirror to find the same damn thing that I had there before still with me. And I thought, this can't be serious. And I was really, really depressed until not far from here, actually. I was at Oxford Circus, and a 22-year-old girl saw me. And you know what she said? For an old man, you look hot. And I thought, this is going nowhere. This is now staying. This is my mantra. This is now staying. I'm keeping the color because I look hot. Hey, I'm 66, so if I could look hot at 66 to a 22-year-old, something has got to be right. So with that as the backdrop, I met this woman that I knew who had breast cancer. Now, let me be clear about something here. If someone close to you, your mother, your sister, has had breast cancer, you need to tell your GP. Because breast cancer can come down to men as prostate cancer. It can come. And also ovarian cancer. The two of them. You need to let your GP know. You need to let your GP know if prostate cancer is in your family. They need to be aware of this. Right? This helps them make that diagnosis. Now, this woman that I knew had breast cancer, and we were in Barking, I was in Barking Market during the pandemic, and she saw me, and she was at the other end of the market, and she shouts my name out, Patrick! And I thought, oh God, what do I have to do with this today? Because she's one who doesn't care what she says. And she came running up to me to say, how are you? I've had a double mastectomy. That's what came out of her mouth, straight away. How are you? I've had a double mastectomy. I thought, well, that's a bit harsh. A double. She said, yes, I've had both breasts cut off. I said, okay. I said, well, why are you smiling? She said, because I had breast reconstruction. I said, okay. She said, I have two of the best looking breasts you have ever seen. And I said, oh, before I could say anything, we are in Barking Market. This woman whipped up her top and said, have a look. And I'm thinking, oh my God, I'm going to be arrested here today. Right? Now I had to look because they look good. Right? And I thought, I've never seen anything on anyone your age before that was like this. Right? She's 65 and she's telling me, she said, hey, women my age, they're looking south. I'm looking east. And she said, listen, when I die, I'm the only one that's going to be in that coffin with two mounds looking up. And I thought, there's a message here. I don't quite get it, but there's a message here. Right? And she then said to me, celebrate your cancer. I said, if you think that I'm going to show my prostate, you've got another thing coming. Because I ain't doing that. Right? But that was where she had something. And I thought, you know what? I went through cancer. I went through chemotherapy. And the only problem that I had was the loss of my hair. I have to be thankful. I have to be good. For some reason, it didn't affect me as how it affected other people. Right? So, to cut a long story short, where am I today? Remember, my PSA was 174. It is now 0.04. They removed the terminal from my diagnostic to be able to say in remission. So hey, you know what? I have a new lease in life. Right? I believe that for some reason I have had good treatment. Now Jonathan asked me before, what is your impression of the NHS? And I thought, oh my God, what a question. That's very loaded. I could say a lot. Right? And the first thing that came to mind, because I was telling him, was this urologist that I met. And I completely forgot that Jonathan was a urologist. And I'm thinking, oh my God, what's he going to think? That I'm judging him just as much as I judged her. Right? But you know what? I met her again. I went into the hospital when I was waiting to see my oncologist, and I saw her. And I thought, no, I got to talk to this woman. Right? And I got up and I said, excuse me. Hi. Do you remember me? You know what she said? Your face looks familiar. And I thought, hey. I said, you had a go at me in your office for having tests without first coming to you. And she was about to say, I said, but you know what? Thank God that it did, because it saved my life. Now, I go out and I talk about prostate cancer and about the need for men to test. This is important. I did mine when I was 63. No man should have to do this at that age. You should be going earlier. Prostate cancer absolutely says that black men and men that are at risk should go now and test at 45. We had a a session where Paul, who is sitting there, is one of the staff members of Prostate Cancer UK, right? And his area is Health and Inequalities Manager, so he deals with black men and men of that diaspora. Hence the reason why he's here today. He's trying to network. So, so please talk to him before, you go. And he was very clear, that was very clear that was an important thing that we all needed to have. Was that understanding that we needed all to test and get there. Whether your GP thinks that this is not reliable or not, it is an indicator. And that indicator helps us along that path. That's what saved my life, and I really will absolutely push that forward. If they hadn't looked at this, I don't know where I would be, maybe 6 foot under. But as I told everybody, including the priest who came to pray for me while I was in hospital, and he brought out his, opened his little suitcase and brought out the black stole and kissed it. I think he's smiling, so he knows exactly what I'm talking about. I said, hang on a second, that's the last rites. Right? You know what he said to me? Oh, be sure not. But just in case. I thought, just in case what? Right? You think I'm going to die. Right? I said, I am going to outlive you. Right? So that's what I say today. You've got to be in a position where you make that firm stand. Come up. Try, get out there. Speak to your GP. Make sure that they understand every single thing in your family, that they know your history. Right now, they test me every 6 months. If I sneeze the wrong way, I'm in. And that's the way how I do it. Thank you.
Thank you so very much, Patrick. I had a more pleasing session with the NHS. They were very, very, very nice to me, Patrick. After me being tested when my PSA was 109, it was a very, very, very quick journey into my treatment. And by June, I was getting my radiotherapy, 35 doses over a 7-week period, Monday to Friday. And that probably was the painful part about it, having to hold your urine during those sessions. And I'm telling you, you drink so much water just before, and you've got to hold that water during that session. And many a day, when they finished that treatment, the wife, she attended every session with me. She can tell you that some days I actually left my shoes in the waiting area and just went to the toilet to release that bladder. That was the painful aspect of it. But the other aspects where the NHS, the nurses, the radiotherapists and all of them, the urologists and the oncologists and all that, they were very, very, very nice and helpful to me. And I would take my hat off to the NHS, such that they've asked me now to be the poster boy for the radiotherapy department. So if you see a couple of these posters around, and my word to everyone is early prevention is the best medicine. So my hat's off to the NHS. And that leads me now to our next speaker, who represents the NHS here this afternoon. Dr. Jonathan Noel, who will come and enlighten us as to the very good work done by the NHS department. So give him a rousing round of applause.
Afternoon, everyone. Thanks for having me, High Commissioner. And I had a few slides prepared, but after hearing Mrs. Stevenson's, Ms. Williams, I'm always taken aback by these community talks to hear the real deal, the lived experience, the effect on the family, the psyche. It's humbling, actually, because I think as doctors we can get very stuck down on figures, processes, procedures, but I always like to do this because it brings me back to reality, so to speak. So I hope you do engage with us after, or even outside of this table, because it helps us get better. I was thinking in my head how I would speak today. I'll go from the beginning just briefly, because I've always found that sometimes you can come to these medical conferences and not really be sure, what is a prostate? Where is it? What does it do? What's its function? So the prostate gland is a male accessory organ. It sits underneath a man's bladder, and it can get enlarged over time. You have heard from before with speakers about the changes in your hormones as you get older. Those hormones can cause a prostate can grow, and it could also change into cancer as well. So the first signs of it growing is going to the toilet a lot, not emptying your bladder well. It's stinging, it's burning. And usually that sets in from about age 50. It varies. When it's enlarged, you can get a benign enlargement. Go as big as a grapefruit sometimes. That needs surgery. But it's benign, not by accident, benign because you've come to a urologist and we've ruled out cancer, whether by a biopsy or a scan. And there's treatments for that. So you shouldn't automatically think my waterworks acting up means I got cancer. It could be a benign enlargement. But you should present and ask questions from your GP or your urologist. Or I'll go out on a limb and say even me through the High Commission. It can get irritated and inflamed if you have a urinary tract infection. And that stings like really badly. That sometimes was for younger patients who are not practicing probably safe sexual practices. So that's a different treatment altogether. But why we're here today is to talk about prostate cancer. Prostate Cancer UK is well represented here. So engage with them. They're a very good charity, amongst others. But it is the most common cancer in men. 1 in 8 overall. 1 in 4 for black men. There's numerous reasons why, and I'm not going to pin it down on genetics only. That's a mistake. We've heard data quoted from the United States. Their healthcare system is very different from a UK system. Their healthcare system is very different from a Caribbean system. They're insurance-based. That drives inequalities in everything. So I take data from the US and I hear it, but I do want to speak to where we are now. So in the NHS, you should have the same right to care as anyone, no matter what your background. And you should expect that care. And that's one of the things that brought me back to the NHS versus staying in the US where I was last year. The prostate blood test, or the PSA, you hear that floated around. PSA, what's the number? PSA, PSA, PSA. That's just a blood test. It measures a value, and that value is dictated by your age category. It's all online. I would go out on a limb and recommend that your PSA is checked from age 45 50, depending on your family history, your background. But you must be aware that the UK do not recommend prostate cancer screening. After all we've heard today of men in their 60s presenting with PSAs skyrocket, stage 3, stage 4, chemotherapy, we're not recommending screening. It's an individual-based decision. You know, you come forward to your GP, you ask for it. That's what they recommend. Now, if that happens, sometimes GPs do not agree with PSA screening and you won't get it. I think it's important that you engage a lot and seek support from charitable organizations to help you in that case. Don't give up, it's your health, okay? The prostate cancer is slow growing, happens over a number of years, and the treatments are quality of life impacting. Usually your waterworks get affected, your ability to have intercourse can get affected, your ability to have more children if you were still at a stage where you wanted that will get affected. So, over-treatment sometimes can happen as well, and that's why right now there's no recognized national screening guidance. But we are working on it because we're seeing a change. We're seeing more prostate cancer in young men. Yes, probably very rightfully so, it is due to diet. We know we enjoy a westernized diet. We like a lot of salt, a lot of cholesterol. I pass by here on the way here, I ain't gonna lie, I look at Five Guys burgers and I say, and get one after this. You know, it's habit, it's not great, and we do need to exercise, drop weight, control your cholesterol, control things you can control, because once cancer sets in, it sets in, you're in for the journey, okay? If the PSA number is high, then we suggest you see your urologist. Once your PSA is checked, we usually get you seen in 2 weeks. Patrick had a different experience, 2 months. Unheard of from me, but I only work in one organization. And we're all not bad. Then you would be referred to someone like myself to be seen, and we'll make an assessment. If it's high, I would recheck it, because sometimes it can be falsely elevated. Okay? Maybe you had intercourse the night before. Maybe you had a long flight from Barbados. These little things can change your PSA subtly. The examination. You can cringe, you can move around your seat if you want. I make no apologies for it. How am I going to find out if you're likely to have cancer if I don't examine? You want me to guess? It's 5 seconds. Once that's done, we do an MRI scan. In the UK, unlike the US, every man with an elevated PSA gets an MRI scan. That's led from a trial, UK. We've changed it. The Americans are looking at us and being envious of us because some men with different insurance categories can't get MRI scans. They can't. Inequality setting. Here, every man with an elevated PSA gets an MRI scan. It's fantastic. It's really good. Because the MRI scan can then show me, okay, there's something sinister. I'm going to recommend a biopsy in the chair. Oh, it looked clean. Bye-bye. See you later. You never had a biopsy. That's the new thing now. Probably the last 5 years. And that's what I'm going to talk at a GP conference on Wednesday about. To tell GPs, don't be scared to check their PSA. It doesn't commit them to a biopsy. It doesn't commit them to treatment. So if the MRI is normal, I'm biopsying you. I'll just say get your PSA checked every year, and if it goes high, come back. Let's reassess you. We're very good in the UK at not over-treating, unlike other countries. if you need a biopsy, yeah, I do the biopsy, so I'm speaking from experience. I do have to. It's a lot about bedside manner. It's a lot about having someone beside yourself, to kind of walk you through it. If patient like music, I play some music, man. Get it done 10 minutes, walk out the door. The most common thing they all tell me is, "Doctor, you ain't gonna do that again, though." That's it. But we get an answer. We get tissue. We get an answer. If there's cancer, we score it on Gleason's score. You've heard the numbers, Gleason 10, this, that. That's just a score for prostate cancer. We score it from Gleason 6 to 10. 6 is the lowest risk you can get. If you got Gleason 6 and a little smidge of prostate tissue, we should just be watching you. We should just be surveying you. It's low risk. Very likely it's not going to progress, but we have to check you every year. Again, in the UK, we have almost more than 85% uptake of just surveying patients with low risk prostate cancer. In America, very different. Over-treating. Probably 70% of men with low risk cancer get treatment. Big radical surgery, big radiotherapy. Why? Because of the insurance remits. And it's not, I suppose, a patient's fault because they're cornered. They can't get insurance cover unless they've had the cancer treated. It's complex. I could talk about it all day. I won't get into it. It's just don't want you to walk away here thinking that we have a system that's not worth fighting for. So with regards to the biopsy, we do it without legs in the stirrups because it's cleaner. We don't have to give antibiotics. Infection was a problem where we used to do it the other way, which is a biopsy through the rectum. Now we're doing it through a skin. It's cleaner, and then you don't even need antibiotics now. Imagine that, no antibiotics. Imagine how that would serve Barbados. No antibiotics. Save you from antibiotics. Happy to train my colleagues that are there at QEH to do that. Because I'm doing it at QEH in Woolwich. If your cancer is bad enough, but not as aggressive, or I suppose not spread outside the prostate, there are some options that you can do to have it removed, perhaps, with a robot. That's what I do at Guy's Hospital. They do it open, with a big open cut in the Caribbean mostly. It means you get to go home the next day with the robot. Open, you go home maybe day 3. You need a blood transfusion. All these things, once we are able to introduce robotics to the Caribbean one day, will help perhaps with more uptake of treatment. Radiotherapy, we've heard about radiotherapy. Zapping it so you keep your prostate gland, but it's treated with external beam radiation treatment. A few sessions, yes. You got to have your waterworks well controlled to have it, because as you heard, the minute it's done, you got to go to the toilet. So if a man comes to me and he has a really bad time with passing urine, and they need radiotherapy, then I have to sort them out such that they can pee faster before they have radiation treatment. So I engage with a lot of categories of patients with prostate cancer needs. We spoke about prostate and breast cancer. Breast cancer is related to prostate cancer through a gene. It's called the breast receptor antigen, BRCA 1 and 2. So, sometimes patients, families, we need to speak to each other, right? Sometimes you just keep things together inside, you don't speak. Mom, Dad, what you had done? I've seen some patients, they got diagnosed with cancer. They never knew their father had it. They never knew their mom had breast cancer. kept it a secret. Maybe you don't want to worry your kids, but what you're doing is not helping them to get screened that sooner. So do share it. Do share it. I'm not going to stand here and talk for much longer. I'm really interested in the questions you may have. And hopefully this has been somewhat helpful for you. But in summary, I believe prostate cancer screening is important. It needs to happen, particularly black patients. The statistics just speak for themselves. Age 45 if you've got a very strong family history, otherwise age 50, a blood test. If it's not high, good, at least you know your number, track it. If it's high, come to a urologist. We'll do an MRI. Doesn't mean you're having a biopsy. An MRI is harmless. Treatment, if it's low risk, can be just surveying you with periodic MRIs. Treatment includes surgery, which in the UK, 95% of the time is with robotic technology. You get home the next day. Radiation treatment. And obviously there is treatments for patients who have metastasized with very good results. As you can see here, live and direct. It's humbling to sit next to patients who and hear their stories. It really is. I think in 2023 the outlook is very positive now for patients who have had metastatic diagnoses. Thanks.
Thank you so very much, Dr. Jonathan Noel. I think he deserves another round of applause. As a matter of fact, the entire panel so far deserve a rousing round of applause. Even though our deputy, Robert Charles Morris, has not been affected directly by prostate cancer, he has been affected by one form of cancer or another. And he gave me his story some time ago in respect of the treatment he received when he had his bout of cancer. I know he can speak for the rest of the week. And probably the remainder of next week. But I'm going to ask him just to come briefly and just say a few words on his treatment and the cancer treatment he had some time ago. He's going to be brief, Sir Excellency. He's going to be brief. He promised me he will be.
Thank you very much, Colin. High Commissioner, ladies and gentlemen, good afternoon again. If you see me with a glass of water and sipping it from time to time, it is because I was diagnosed in 2015 with throat cancer. I didn't have prostate cancer. But in 2015, my brother was diagnosed with prostate cancer. And I'm going to tell you this because I believe early action, like all the others, is necessary. He went to the urologist. He went to several doctors. And when I asked him what happened, he said, "Man, the doctor told me blah, 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 blah." And every time he went to a doctor, it was blah, blah, blah. He told me something with prostate cancer, blah, 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 blah. Those were his words. And one thing I can say out front is when you go to these medical practitioners, always let someone go with you. Always. And from my own experience, when the doctor told me that I had throat cancer, I heard nothing else. And in fact, the only thing that came to my mind was forever with the Lord, amen, so let it be. And I asked my brother about prostate cancer, what he's going to do. He said, man, nothing, not really, I'm sure. And then he asked me, well, wait, even if I had, this is what he said, even if I had prostate cancer, and they removed the prostate, would I be able to have sex? I said, but I don't know. And I'm asking the doctor to answer that question this evening. Not for me, but for my brother. For my brother. But the thing is that he went through all of that, and I saw him suffer. I saw him move from a big man to almost a mastic. And it's important that we do these things very early. In my case, I saw a lump growing in my throat, but I was too busy dealing with my brother. I saw this lump growing in my throat, and I allowed it to go on, and then I went to the GP, I went to all sorts of persons. They tested and found nothing wrong. It was okay. And every time I walked out of their office, I felt good because there was nothing wrong. And I did biopsy with Christopher Maynard, found nothing wrong. And then I remember that day he said nothing is wrong anyhow. And I began to walk out. And he said, Charles, come back here. That should not be there. And I'm going to remove it. And a few days later he went and removed it. And on the 9th of January 2016, he called me. He said, come. He said, we had this thing tested and it's cancerous. And that is when, for me, my whole world began to close in. Because everything I heard about cancer was death. And I left his office. I heard nothing else he told me. And my sister, who was visiting from Canada, she said, I could not tell her what happened. And then she and my wife went to see the doctor, and they he told them what happened. And every stage from there on, I went with someone. Because I didn't hear anything else. In fact, I was too frightened to hear anything else. And I had the surgery. And then it was, in fact, yes, I had the surgery. And then I had to do chemo and radiation, which I did. And the first time I had the chemo, the chemo is a strange thing because I expected a reaction from it the very first day I had it. But nothing happened the Monday, nothing happened the Tuesday, and the Wednesday was normal. Said chemo was foolishness. I didn't bother about the chemo. And the Wednesday night I went home, I started to vomit, and the next thing the morning I called the doctor. He said, Doc, I'm vomiting all the time. He said, don't mind, you're vomiting, but you ain't gonna die. Well, that's all they wanted to hear, that I ain't gonna die. And the radiation every day for 6 weeks left scars on both sides, and I couldn't shave, I couldn't even wash my face properly. And here I was thinking that this is it. I will never be the same. And after that, I went to my own district, Black Bess. And an old lady came and she said to me, I heard something is wrong with you. And they said, yes, something's wrong. She asked, what is it? I said, you know what. She said, open your mouth and talk to me. That's what she said. And I said, well, the doctor had diagnosed that I had throat cancer. And she looked at me and she said, touch here. Now, here am I touching a woman's breast that I knew from a little boy. She's old. And I didn't want to, I refused. I said, touch here. And I didn't. And she took one hand and put it there, and another hand and put it there. She had no breasts. She said, this is over 30 years that I've had this. And these were the words that formed part of my sermon sometime after. She said, if I can live, you can live. If I can live, you can live. And from that day onward, I determined that I was going to live. And then she said something else too. She said, but who else could go and convince people to live but you, the priest? You got a big enough mouth to do it. And then it was on the radio. I was on the radio. And people called. I remember a lady called me and told me her brother was stage 4, but he seemed, out of his going. And I talked to him. I don't even know if he's still living. But so many people called and they received a little hope. You know what? Those of us who have had these experiences must tell our story. Tell the story. One thing my boss and I do a lot is tell our own stories. And I believe we gain strength from each other by telling our own stories. And then you realize that these things are not as, they should not be kept as secretive as you think they are. You have not done anything wrong. The thing is that I remember Dr. Miller saying to me during this, after the surgery, said, there was a nurse who couldn't do it. She couldn't come. Because she was so, I don't know, taken over by the fact that she was going to be attending a priest. That these things should be happening to a priest. But maybe humans too. But there's a concept here, and I wanted to disabuse our minds of it. That you sit down and you wait for some miracle. Oh, I'm a Christian, I'm a priest, I'm this. God will do it. No, God is not going to do it because we have to do something for ourselves. I always say, in order for Moses to get the water, he had to strike the rock. And therefore, we have to do something about ourselves. I've noticed that, and this is not, I'm not criticizing, but you see, women got support groups. They form associations. They go and they get a price reduction on this thing and the next thing and the third thing. If you're a woman and you've had breast cancer, come and you get 15% off. We men don't do that. We don't have these support groups. And we need to form, and occasions such as these are important. Do not be afraid to talk about what you have. Because the healing is somewhere in some conversation. I was told to be short, so normally when I speak short, I speak for half an hour. So I'm not going to go any more than that. But the thing is, and I want to say it to any person who may have had any sort of problem, if I can live, you can live. Thank you.
Thank you so very much, Reverend Charles Morris. Some of us no need to go to church tomorrow. We just had a sermon. I want to strengthen a point made, however, by Reverend Morris, that a lot of persons are afraid to mention the big C, the cancer. And when I told one of my managers that I was involved with this, he said to me, Colvin, boy, you were brave. I said, what do you mean? He says, because there's no way I could tell the world what had happened to me. He says, I said, but why? He says, I just couldn't. And there are a lot of people out there who can't. And what Reverend Morris just said is that men are so afraid to talk about what's happening to them and their health. I could go on and on and on to talk about things from a personal standpoint about men hiding, other than to say that sometimes a lady wake up and her toenail hurts, and somebody will know about it. A man will have a headache for 3 weeks, and he wouldn't tell anybody. Well, if it gets more than him, then he would have to say something. But the majority of men, not all of them, but when you talk about men, men do hide their illnesses. And this is not from my standpoint. Talking to the nurses and the doctors, the oncologists, the urologists at the hospital, they said especially Afro-American men, they hide their illnesses. And when they come to them, especially the prostate cancer, it's too late. So early detection is the best prevention. I'm not going to talk much more other than to say that the floor is now open to questions and answers. Stephen is going to have a microphone in the audience, and any person who is desirous of asking any member of the panel a question, just raise your hand, the mic will come to you. We have a mic on the table, so they don't necessarily have to come back to the podium, but they will answer the questions that are put to them at a point in time. So, questions from the floor. I can see someone beaming with a question, yes. Where's the mic, Stephen? Or you can probably get this one. Use this one. Should I use this one, Stephen?
Identified with everything that the Reverend said. I was diagnosed with Hodgkin's lymphoma, which is terminal, and I didn't take anyone with me to the hospital. And when I was told, everything just went over my head, just as he said. And the other thing is, after I've had my radiotherapy and all the treatment, you go to the hospital the first day, you have your first therapy session, and you think, oh, this is easy, nothing wrong with this, because for the first week, nothing happens. You don't see anything within your body, any changes. By the second week, I could hardly walk up the stairs. I was going up my stairs on all fours. Your saliva is all frothy, it was terrible. But the other thing that I can say to you that I did, after I recovered, I started a group. We started with 8 women. We have 126 now on board. So we have coffee morning. We talk about cancer, breast cancer, throat cancer, all sorts of things. But we have professionals that comes in and talk to us about that. So I thought I'll be the first one to speak, just to follow on of what you said, what you just said. And it really does help. I've been asked to start a men's group, but I said I can't do that. I will do it from behind the scenes. I can start it up, but the men would have to run it, do we? And we were told to start a men's group as well, yeah. So I don't know, we'll have to see about that. Okay, thank you.
Thank you very much. I can say that Lewis, the diaspora here, she is seriously looking at starting a men's group with its base being here. She spoke to me at length about it, so I can tell you that yes, we are looking at that possibility. We were hoping to have done this last year, October, but circumstances didn't allow us to. But trust me, we will get together and we'll start a men's group. I tried one at my church, but my work didn't allow me to. But the fact that I'm working so close to here and we can start one, we will try to get that going, to get men, because men really don't talk among themselves about anything. So we need to get them together so they can form a strong association. Any other questions? Yes, Colvin.
My name is Colvin Edwards, and this lady talked to a men's group. I'd like to thank my friend I'd like to thank Maskell for his speech, because he talked about the men's group in Forest Gate. We had a men's group called the APA, Association for Prostate Awareness in Forest Gate. That gentleman was one of the speakers, Maskell, and he was also one of the members. And I appreciate much for what you said this morning about going and get a checkup. And I, for one, talking to my doctor 2 weeks ago, I'm fully clear of prostate awareness, my cancer. Because I keep in touch with my doctor, I make sure I get my tests. And about the men's, we are hoping to start on their men's again. And as you said, some men don't come forward, but I can tell you that I'm all clear. I have nothing to hide as far as I'm concerned. So all those men who got something to hide, that's their business. Because they're the one that will suffer. Thank you, Maskell. Well done today. I can go back and tell the boys about it.
Gospel.
Thank you, Maskell. Thank you. I'll tell the boys about it.
Any other questions from the floor? Yes, another lady over here.
Hi. My name is Sancho. I'm one of the chemotherapy nurses. It's just a question for my man on the end. For your journey, has it had an impact on you physically, emotionally, psychologically? Because with me, I work with many breast cancer patients, mostly fat body image. I haven't had it from a man's point of view in regards to prostate.
Yes, it has had an effect. Yes, it has had an effect. One of the things that I can say is because that I had hormone treatment, I remember that when that started, that no one had prepared me for this. No one told me what some of these side effects would be. I remember being on a tube and suddenly so weepy and thinking, why on earth am I like this? And this was coming at ridiculous times. I suddenly had hot and cold sweats. On the tube, could you imagine when I drank on a crowded tube and you're thinking, good God, I've got to get on, right? And then I had the mood swings, I had everything, right? So I've heard a lot of men call this menopause. So, we have that sort of thing that's very close to menopause, so to women. I can't begin to believe that it is anywhere near what women are going through, right? But that is one of the things. But one of the problems that I had, having had chemotherapy, which was much later on, was that I had slight lymphedema that started to have an onset in what was going on. Right now, I walk with a cane because I have problems with mobility. I am actually seeing a physiotherapist at Guy's, and we're trying to work out exactly whether this is a direct result of having the treatment. Well, he hasn't told me whether that is yet or not, but it appears that can happen. Okay?
I can vote for that as well. The hot flashes, they hit you. Yes, they'll hit you at the most inappropriate times. Crowded trains, on the bus, and your beads of perspiration, and the bus window, you're asking someone to open the bus window, it can be awful, such that I would travel with the whole roll of kitchen towel. Yes. And one of the other signs that they said to me that could happen was the fatty tissue around this area. So I started to develop some what they call man boobs. And I was told, I only hope that I don't come home and find you wearing any of my, you know what. In terms of mood swings, I keep asking, I say, John, did I have any mood swings? She says, not that I can think of. I think that you're just the same. Your mood swings just like before. But one of the things that I can say in a positive, that I could sing well before, and now I think I can sing better. But yes, it does, the hormonal treatment does have that imbalance or off balance, and it can have that effect on you. I was warned that these are things that can happen. Like I said, I had some wonderful nurses, urologists, oncologists, and they warned me that would happen. The other thing they said was, you would lose some hair, but hey, you don't really carry any hair in your head, so that's not a problem. Any other questions? Yes.
Yeah, hi, good afternoon, everyone. Pity we're talking about prostate cancer, and we have so few men here. I think, women outnumber the men here this afternoon. That's unfortunate because we're talking about men not being open about their health, whether physical or mental health, and why it is. Yeah, so yeah, and I think it's about creating safe spaces for men to speak openly about what they're going through. I just came from a men's group in Forest Gate, actually, at the Durnhill Hall? Durnhill Hall, yeah.
That's right.
And before we left, I engaged, so it's about 12 of us, and I engaged men and I asked them, why is it they don't talk about their own physical and mental health? And a lot of them say it's because they don't want to be made to feel vulnerable. And so it's about creating safe spaces. And one of the things I left them with, because I'm a prostate cancer survivor, I was diagnosed and treated in 2021, and I had good treatment at Guy's. I was diagnosed in July, the end of July 21, and I was treated at the end of September 21. I had the robotic prostatectomy. And so far I'm undetectable. My PSA tests are coming back undetectable. I hope that continues. So, and the question I left them with is, I went around the table, when's the last time you had a PSA test? And most of them never had one. And I encouraged them, go and have one. And the doctor said from the age of 45, I would even say even earlier. Especially if you're a black man with any history of cancer in your family, 40, and until we get a better blood test, I would encourage men to have it at least every 6 months, because we get false positive, false negatives. I'm sure the doctor will endorse that. And one other thing I would like to say is about a national screening program for prostate cancer. I might sound controversial. I've had this conversation with Prostate Cancer UK last year, And the question I asked them, why isn't there a national screening program? And their response was, they don't want to overtreat. But I said, you don't overtreat. It goes through stages. PSA test, if it comes back high, then it's a rectal examination, then MRI. So it's a process before you start treatment. So that how is that over-treatment? And I said to them, if it was 1 in 4 in the other way around, there would be a national screening program. I might sound controversial, but as black men, we need to speak up about our health. And when we go to doctors and ask for PSA tests and we are turned down, we have to insist. And I'm glad Dr. Noel is going to speak to GPs about this, because they have to understand, stop turning us away. And women, encourage men in your life to get tested.
I think Patrick wants to, just 1 second, at the back, I think Patrick wants to respond to.
Yes, thank you very much, Chair. I can actually say, and Paul will be the person to give the better understanding of this, is that Prostate Cancer UK presented to the screening authority, right, all the facts and information which is now being considered about the idea of bringing in a screening program. So that has now been done, and we are awaiting the response and answer to this.
I'll go further and say that that's brought up because the European Council has recommended PSA screening under the age of 70, which is a landmark victory for prostate cancer diagnosis. That was in September. So things are changing, and COVID has caused a lot of badness, but it's laid bare the inequalities. So people are standing up and saying we need more initiatives like these. So let's see.
And the gentleman in the back, and then I think we have 2 questions online as well.
Hi, good afternoon. I'm Nigel Holligan, and I also was one of the founder members of APA, the Association of Prostate Awareness. I'm also a cancer survivor as well, prostate cancer survivor. I echo the sentiments endorsed by my colleague, because I was also concerned about the absence of screening. And similar to him, I also believe that if statistically the indigenous population was 1 in 4, then we would probably have it. But I'm pleased to hear that at least something's being done and the hope and expectations are fulfilled. Furthermore, Paul, pleased to hear that you're thinking in terms of starting a male group. Call me, I'll assist you. My brother, pleased to hear also that you're in Forest Gate. Let's have a chat later on, because I think that we need to get that conversation going. I think that we as a people need to take that responsibility. Too often we are told we're late presenting, you're hard to reach, etc. I don't subscribe to that notion. We're hard to reach because we don't present. And when I hear people talk about prostate cancer and they seem to be embarrassed, I draw the analogy and I say, right, what about if it's AIDS? I can understand an individual possibly having concerns about AIDS because of the elements and the back and negative publicity associated with AIDS. I can remember once I had my diagnosis and once I had the surgery, I had the radical. I had, and I remember going back into my office and speaking to one of my colleagues. And she said, what side effects are? I said, well, look, occasionally I have a bit of, sometimes I may sneeze or some things you have. I said, look, if you're worried about that, that's nothing. If it's just, stress related, think in terms of the ladies who have that problem every month. That brought it into perspective. And I think in terms that we, as I said, we as men need to take responsibility, but also we need our partners to assist us. And I'm pleased to hear when we said that when we presented, you heard big C and nothing heard that. My father, my late father, God save him, he was one of those individuals. Never talked about it. It's only because my involvement with APA that I started asking questions. And I then subsequently found out that my father had 2 maternal uncles and my mother had breast cancer. So as a consequence of that, I was aware that the incidence to me was going to be higher. I presented, I bombarded my GP because he didn't want to do the PSA. I told him I realised the false negatives, ultimately did that. And I kept repeating that for 6 months. And when the PSA arose, I then had the necessary tests, etc., etc. And as I said, it came about as positive. But please, young men and ladies, encourage brothers, uncles, whatever, to have that test. Yes, I know there's the ignorance associated with VRE. Look, what is more important, a finger up your bum or saving a life? Thank you, ladies and gentlemen.
Thank you. I think Tina wants to ask a question.
Right. Good evening. My name is Augustina. I'm a nurse. What's the young man in front of me here name? What's your name, sir? Right. You alluded to women. And when you was talking about giving men a forum, I work with GPs, and even when the men come in, even for that 40 you get an NHS health check, and you breach this thing about having a PSA with a lot of the black men. The first thing, they don't even want you to put that blood test there. They don't even want you to talk about it. It was the same way with women with cervical cancer. It took Jade Goody, when she died, right, to let the women be aware that you need to have your cervical screening every 3 years. It is still a problem with getting, especially the younger women and some of the older women, because it's done from 24 years and 6 months to up to when you're 64. You still have a lot of them will go 10 years. It's only when something happens down there, they come in, oh, this is happening, the next is happening. When was your last smear? 10 years ago. They're still not, although women have a forum, we still have that problem with getting them to do it. It's an even harder problem, me as a nurse in a general practice. When they come in for their NHS health check, and you say to them, okay, you're 45, you're 50, I'm doing your routine bloods, can I put a PSA on them? You explain to them what it is. From the time you explain, nah, I don't want that. So yes, you give them a forum, you have a nurse, people, they will come in, you talk to them. Well, at the end of the day, you can only give them the information. What they do with it is entirely their choice. I know Dr. Noah said that we'll be having forum with the GPs. A lot of GPs do offer the men. I know, I work with loads in Islington and in Haringey that offer the men the test. They refuse. There's so much you can do, but it will take some of you men that are in these groups to go out there, put something, either even if you do it on TikTok, all the local methods that people look at things, and see if you can get home to some of them that it is important, because the government is putting up there. Calvin got that billboard. That billboard was out every way you could think about. How many men do you think went and get a prostate test? Yeah, but we need to try and capture. Most people look at social media. We need to capture the TikTok, the Snapchat, the Facebook, all those other medias that people will be sitting on their phones daily. When you keep bombarding it with all these things about prostate and all the different things, or letting men know there are places they can come to talk about things, because a lot of the men were instilled by some parents, oh, you don't cry, you don't say this, you don't say that. Most men in the older generation, you were supposed to be stoic. You don't cry when you're hurt. You don't talk about your feelings. And a lot of men come along with that. Some of we mothers teach our boys they're not supposed to cry. They're not to talk about their feelings. So it stems from there. So men like yourselves, thank you for forming forums, can get out there and put it out there for the men to let them know, yes, there's nothing wrong, you're not seen as weak when you speak about things that are going on with you, because that's when you get help. Thank you.
Thank you. I'm very aware as to everything that you have said. Like I said on Calvin Edwards, he knows how he tried to start the men's health group in Edmonton, and I was told by someone, men's health. When you hear about men's health, you think you talk about mad people or mental. That is what I was told. And they waited until I wasn't around and changed the name to Men's Fellowship. When in actual fact, I wanted it to be a men's health group to zoom in on health issues surrounding men. Not only things like prostate cancer, and Vasco did come and did a presentation for our group then, but there are a lot of other things that affect men. Men don't talk. And I mean, I can go back to situations where wives were very ill. The men were the ones, the husbands looking after them. And the men died and left the women because they themselves were feeling ill, but because they didn't want to show, you know, their illness, they look after the wife. And then the next thing you know, they are ill themselves, they die from heart attack, they die from stress, they die from all these different things, and the wife's still living. So men don't talk. And it's about time that we, and that's why I said I was happy that Betty mentioned it to me, that we need to have a forum where men can come together and express themselves among themselves and see where we can go from there. So my friend at the back, he's all for it, and I'm sure a lot of other men in here who, I'm just hoping that when we put it together, that they all come forward and let us form a strong 160. I think the young lady said there's 160 women that form to work together. If you can have 161, that would please me.
Just to say, Guys and St. Thomas's is a black men's prostate cancer group that Guys and St. Thomas's has. That's ongoing, and it's led by the black clinicians at Guys and St. Thomas's. So they have once a month they meet. They used to meet online and hoping now to meet face to face.
Okay, I think there are two questions that came in online. Lindell, are you going to read those questions?
With your permission, what I would like to do is to make a suggestion. I would also like to give a personal perspective. There's also, and I'm going to be quick, I'm not really long. Yeah. There's also two questions online. One is from YouTube, one is from the chat on Vimeo, which is a private network. But I'm not too sure how appropriate that question is. So what I'll do, I'll give the question to an expert, and an expert can say if that question is appropriate or not. But on the YouTube chat, someone by the name of Jesus Jones has said, why is hemp oil suppressed when it cures cancer? Yeah, someone has asked, why is hemp oil suppressed when it cures cancer? It may not be factually correct if it's not just...
Okay. Evidence shows that hemp does kill cancer. There are other natural products that kill cancer, but by and large, the establishment was not in favor of rolling these things out because we come back to a simple statement, follow the money. And I can tell you one product off the top of my head that has been banned in the United States of America because it was actually a cancer killer. It goes by the name of vitamin B17, okay, which is simply apricot seeds, right? You're advised not to eat too many of them, 2 a day, but there is evidence, and this is not anecdotal evidence, this is hard science, that says apricot seed or vitamin B17 is an antidote for cancer, and there are lots of others, including hemp. And it's the establishment, the money people, the pharmaceutical companies really, who don't want this rolled out because there's no money in good health.
One question to you then, Vasco. What about soursop?
Soursop. A lot of people misunderstand the soursop. They say soursop leaf. But my research tells me it's a combination of the leaf, the bark, and the roots. And this is coming out of Brazil. And yes, we also have guava leaves, which is quite good. And another thing that is exceptionally good, according to reports, for any kind of hormonal cancer, breast cancer, prostate cancer, anything like that, believe it or not, is iodine. And you can get iodine from any sea vegetable, kelp, bladderwrack, Irish moss, and of course the fish, sea bass.
Is the question appropriate? Yes. I had to ask that question first.
Online question, I'll just give you the question and I'll give you the answer. At some prostate cancer awareness events, it has been suggested that for men who are celibate, such as priests, widowers, being told that one should regularly get rid of the built-up semen. How should they deal with that issue? Some Christians are against masturbation. My personal and professional opinion is that I believe the Lord will understand as you are trying to lower your risk of having prostate cancer. It has been shown seriously in studies that frequent ejaculation does lower your risk of prostate cancer. And I signed my name there as well if they want to follow up with any questions.
So I'm going to take this opportunity to ask Dr. Noel a question. Frequent ejaculation lowers the risk of prostate cancer. How would that affect men who have had the SNP?
That's a very good question. When you actually do ejaculate, your prostate fluid will come out. It's not much, but it's from the testicles that have the semen. That's where the SNP happens. Right. That's independent. Right. So a different piping system. But very good question.
Now I know where the SNP happens. I haven't had one, by the way.
But therefore, you can go on to answer the question that I was asking for my brother.
Yes, you can have, after radical...
You can put one there on the desk also.
I know, but he's right on. After radical prostate surgery, the question was posed, can they have intercourse? Everyone is different, I have to say, first of all. And every man's potential to recover is different. So usually the younger guys with normal erections do the best. Also the patients who have very low stage cancer. If you've got a very aggressive stage cancer, chances are the nerves are going to come out with the cancer. The nerves that help you get erect. So it's very situational, but looking at large studies, if they're not on any topics that help with erections, they have erections spontaneously and naturally, and they're able to spare nerves on both sides using at the time of surgery, then they should recover about a year to 18 months with tablets, pumps. Sometimes they do need some things as injections to help them get along as well. The term use it or lose it is very relevant here after surgery. So we really encourage them to get with it.
Can I just make that one quick point and suggestion, please? And can I thank everyone for inviting me here today? I get the opportunity to do great things with my camera every day, all around London. And it's amazing some of the things I go to, but I found today very educational and very useful for me, and as a direct result, next week I'm going to my doctor. And the reason why, and the reason why is that I'm now 57, 58 years old, and when you talk about them symptoms, I'm beginning to see them symptoms, but what pushed me over the line was when you mentioned breast cancer. My mother died of breast cancer 4 years ago. That was a trigger in my head. Let me go to the doctors next week, and as a direct result of this, I will be going there. The final point being, I love what I do. Most of you who might know me will see me Speaker's Corner all around London doing all kind of political stuff, and I love it. I go to Speaker's Corner every Sunday. As a filmmaker, I engage with all of those contributors down there. They've got millions of viewers. The big guns are, I call them. But the important bit for me is, at the moment, because of the subject matter we're discussing, we may not get the views, and we're not. I can guarantee you, if you took this down Speaker's Corner, you will be surprised the thousands and the thousands of people who would love to listen and engage in what you're doing. And there's a gentleman down there called Danny Shine. He goes down there most Sundays, and his discussion is real men don't breed. And it's some crazy discussions people have down there. But people engage and people listen, and that's my suggestion coming out of this. If you get the opportunity, pull up a box down Speaker's Corner. You will be amazed the amount of people who are going to engage with you, and I'm there tomorrow.
Can I also make a point here that this hasn't come up yet in the discussion this evening, but 10% of men who have prostate cancer will have no symptoms whatsoever.
That's right.
Hence, it's imperative to go and get checked regularly.
Any other questions from the floor? One lady?
One more here.
Yeah. And then we're going to do some wrapping up.
My name is Monica Waller. I'm quite pleased to hear that you are no longer the biopsy director, because I worked as a nurse in Barbados Hospital Radiology, and I used to prepare the patient, assist with the biopsies and everything, and it is not a very good procedure, especially correctly, consider they had antibiotics, and there was always the risk of bleeding also. Okay? What I think you need to emphasize to get more men to go and have the checks is to let them know that the biopsies are no longer correct. And because that puts a lot of men off. Alright? And yeah, PSA is not too much of a problem, but a lot of men are really scared to check their bodies and to follow through. My late husband was like that, and he had high blood pressure, diabetes, which he thought he didn't have. He also had cancer of the prostate. He sat on it, he left it until it spread, and he had bone secondaries, and that's when he died. And my son is in his mid-30s now, and I'm hoping that the GPs will allow him to be screened at an early age before he gets to 40. So I'm pushing for him to have early screening, because there's also other cancers in my family also. So we really need to get the screening. The routine screening needs to really come on board.
Thank you. Any other questions? I will just ask the panel to do a wrap-up. There was a question from a lady here. Sorry.
Can I just say, I'd like to say something, but I don't want to be on camera. Is that okay, Mr. Cameron?
Your microphone. Use your microphone.
Camera is still away from you.
For years now, I've been trying, my name is Oreo Reed. For years now, I've been trying to get my son to go to see a doctor to have the same test, and he refuses to go. I just guess he's watching this. It's the reason why I don't want to face on the camera. But he's going to be 60 2 weeks' time, and I'm telling you, I just can't get him to go. But that's what I hope you can do something encouraging for me, please. Yes?
Well, we tried something earlier on, a couple of years ago. We went for the first to visit the mobile. Remember? Well, he told me he went to visit the mobile unit that was in his area. We did set him up, by the way, Tom and I. And he wasn't very pleased, he sent me a text, Mama's put you up to date and what have you. And I'm not going back.
But if he's of that mindset, there's very little we can do. The important thing is that the man has got to look after his health. And if his mind is against it, putting a stick of dynamite under him will not help. So, his issue.
I don't know.
And you were a nurse.
Yeah, I don't know.
And you're his mother, and he's not listening to you. So what else can we do?
Anyhow, thank you all for listening.
Thank you. So we are going to do, yes, you want to say something?
Yeah, I'd just like to say quickly, we use the word remission so frequently. For me personally, I don't say I'm in remission, I say it's gone. Because if you say you're in remission, to me, like you're expecting it to come back. When you go to the cinema, you're in remission. You're going to have something to eat. But I never said I'm in remission. When I went back to my checkup, the doctor was shocked that I went from one level right back to 0, and I am cancer free. And I say that freely because when we say things, we put words in motion. And I think, I always tell the girls in my group, that's the reason I formed the group, because there's a lot of people out there saying, I'm in remission, I'm in remission. But I just say I'm cancer free, it's gone. And I think that's what we should use instead of using the word remission.
Yeah, remission and not intermission. Yeah. Okay. So we're going to do a wrap up. Let's ask each panelist just to do a couple seconds to do a wrap up. So we're going to start with Patrick.
Right. As someone who has had advanced prostate cancer, let me just clarify something very quickly here for you. When you are diagnosed with advanced prostate cancer, you cannot be healed. You are managed. I am managed. That is what they do. And they keep me under surveillance. They look at me continually over the time. Even though that what all my markers are below, that's fine, but there's a possibility that things may not stay there. So it is being managed. So the first time that it starts to raise its head, they can move in quickly. Now for me to wrap up, just to be clear, I sit as a patient rep on 2 clinical trials, Stampede 1 and now Stampede 2. Prostate Cancer funded the Stampede 1 trial. They're now looking into the Stampede 2 trial. Now what that means is that there are a raft of new procedures that are coming online so that people like me who are in the situation that I'm in do not need to suddenly have that death sentence. There are more options that are coming our way. But everything needs funding. Everything is there. It doesn't just happen because, well, okay, that's fine. It needs funding and all that. Now, at the back, there are these pins that are here and a collection tin. I would say be generous and do that, because the money that goes to this goes towards funding that. Now, I work within prostate cancer as a volunteer, and I can tell you, yes, money is used for infrastructure and stuff like that, but not these pins. That's not what they're there for. So get one if you don't have one. If you do, just put a donation in the back. That's what this is. Because for me, that is what saved my life, because that is what I had. And she's raising it in the back there so you know where the tin is, but the pin is on the back as well. Thank you.
I'm just going to say, change is coming with regards to screening. I really believe that. We live in a time now where there's a lot more light shed on inequalities, and people are really standing up to change it now. There are lots of allies from all backgrounds and all groups out there. And just talk to your GP and get in touch with your urologist. And I'd be happy to join that men's group when it comes to form.
Just let me reiterate that to hear the word cancer does not mean that it's a death sentence. We can recover, but it is up to us as well. We have to do our part. Even the caregivers have to do their part, but at the same time take care of themselves as well. And I will still insist that we men remove ourselves from that ancient theory which stated then that you must hide what you have. Let it go. There's an abundance of help in the community. And let me tell you, if there's one thing about humanity, is that we're all social beings and we depend on one another. Thank you.
Thank you. I work on the premise that all disease can be cured. Okay? There's no such thing as cancer that cannot be cured. If you understand diet and the human body, you will understand pH. If I say pH, will you understand what I'm saying? Potential of hydrogen. And that tells you whether your body is alkaline or acidic. Okay? And it works on a scale from 0 to 14, with 14 being the most alkaline. 7 is meant to be neutral, that's where water should be, but of course the water today is not, drinkable, so to speak. My thing is that if you're diagnosed with any disease whatsoever, and you go through a serious process of alkalizing your body, there's every single chance that you will get rid of whatever challenge you have with that disease. Because cancer cannot survive in an alkaline environment. Okay? So if you eat your greens, your broccoli, your spinach, use turmeric with black pepper, perhaps the best herb in the world, you stand a very good chance of eradicating any disease you have.
Thank you, panel. A rousing round of applause for the panel. It's not my duty to say thank you. That one is over to Augustine Nelson, who will come and give the vote of thanks. You want to say something?
Good evening, everybody. Calvin, my name wrong is Augustina.
Augustina.
I would like to say heartfelt thanks. One to His Excellency High Commissioner, Mr. Milton Innes, for allowing us to use premises to hold such a good and informative talk about prostate cancer. I would also like to thank Deputy High Commissioner Mr. Morris, Mr. Stevens, Mr. Collins, Stevenson, sorry sir. I would also like to thank Dr. Noel for taking time out of his busy schedule to be here to inform us and to give us information regarding prostate cancer. I would also like to thank all the people who have been through cancer and give us their own experience. I would also like to thank my colleagues who are all here. You can tell us by the colors of the shirts and the logos, and all the invited guests for blessing us with your presence today. Now, as a nurse, I have learned something today, because every day we can learn something from each other. I would hope that we will see a few more faces along from this first one. All who is here can pass the word around. We'll be having another one in May, so we can get a few more people here that we can share, and we can also learn from each other. So, thank you to everyone for coming, and I hope it's not the first or the last time I see your faces. Thank you very much.
It was a little oversight in not saying thanks to Mr. Patrick Williams. So we're going to give him a special Bajan thank you by applause. it was just a mix-up in the names. And I'm sure that my good friend and His Excellency will want to say a heartfelt thank you for everyone who came this evening. And I'm going to invite him, His Excellency Milton Innes, our High Commissioner, who loves to speak as well and loves to talk, and he loves the microphone, to come and say a few words as well.
Thank you, Colvin. The speech should be short like me, though, unlike the deputy. Deputy, ladies and gentlemen, I just wanted to say thanks to the Barbados Cultural Organisation for hosting this and for the future events. And I would suggest very strongly that this needs to be an annual event. The High Commission stands ready to partner with you again, as you require. And I think it is important, along with what was said. I remember as a child growing up, old people didn't even say the word cancer. It was the big C, it was the thing, there were all sorts of euphemisms. It was as if the very action of saying it would bring some sort of retribution, or it would bring it on themselves. And so we've come a long way when we can speak freely. I agree with my friend here and other gentlemen in this forum that men really do not speak about these things. They rarely speak about a common cold, far less, cancer, and something as sensitive as prostate cancer. I had a very good friend many years ago. He's been dead now for some time, but I remember we were away and he said to me, something is not right. And I tried to persuade him when he came back to London to go and see to it, which he did not. And then he came to back to Barbados, and I went with him for his check, and by that time it was stage 3 cancer, prostate cancer. And I remember I went with him as well when he had to have the biopsy, and as my friend here said, I remember him saying to me that was pressure. It was not an easy or comfortable experience. He unfortunately, by that time, it was far too gone for anything to be done. And he died some 12 years ago. But again, had he listened, had he had his checks, because he'd never had a check, he'd never had a PSA test, any of those sorts of things. It was something that he just could not apparently bring his mind to. And indeed, in the last days, all sorts of other issues occurred. He had a stroke, all sorts of things occurred out of that. So it was really quite a sobering experience that we had. But it is important, and as I say, the ladies, and despite my friend there, I think it's also useful. You formed your group. I think you need to be part of encouraging men to form these groups. Yes, it is a conversation that will go on for many years, but you have men here who understand. They in turn need to widen the circle, and hopefully as years progress, you get a different attitude to how men can sit down and talk openly about any disease, not only prostate cancer, but any sort of illness that they may be going through. So with those 2 words called in, thank you very much. Thank you very much to our panel, our guests. Jonathan I've known since he was a little fella, so good to see him talking as a consultant urologist. So thank you, and enjoy the rest of your evening.
Thank you very much, Your Excellency. Other than to say thanks also to Wendell, our streamer for the evening, and just to let you say also that refreshments will be served at the back, so enjoy and intermingle and just get to know each other better. Thank you very much for coming. See you soon.